Hey guys, Lauren here with Bizrok. In this week's video, I want to talk to you about an exceptional experience for your patients, specifically when it comes to the patient tour. So, hopefully you have done training with us in the past and you've started to slowly implement this. But if you haven't, I want to talk through, first of all, why you would even do a patient tour, some things that you would even say on a patient tour, and then the logistics around giving a patient a tour. So first of all, why would we even do a patient tour? Well, our patients deserve an amazing experience. Have you ever gone somewhere and maybe it was a hotel or a restaurant for the first time, and maybe you just needed to go to the restroom and you didn't know where to go, and somebody just quickly pointed, oh, it's around the corner and then turn left, and you're like, oh, okay. So you start walking back towards the restroom, and maybe you're looking around, looking lost, and you're like, gosh, I really wish somebody actually took me there, right? So you do a patient tour because we don't ever want a patient to have that experience. Some of you have just these beautiful, aesthetically pleasing offices that are the Taj Mahal in your area. Guys, first of all, if you have that, you should be showing it off. You should be pointing out some amazing things in your office. You should make the patient be like, wow, I can't believe this is my new dental office. This is amazing. And for some of you, what makes you really special is the history in your office, how long you've been in the community, the type of technology maybe you have in your office, maybe the type of unique services you provide. Every single practice has something that makes them unique. So for you guys, you've got to figure out what makes our practice unique. Is it the people? Is it our technology? Is it the updated, renovated facility? Whatever it is, you want to highlight on those things. Plus, imagine a guest coming to your home for the very first time, whether it's a friend or a family member, and this is their first experience in your home. What do we typically do? Well, for a great host, we welcome them in, we greet them with kindness and welcoming words, and then we give them a tour of the office, right? And so that's the purpose of the patient tour, is really just to set ourselves apart and make our patients feel comfortable and as if they came to the right place, okay? So front or back with regards to who should deliver the tour, guys, I'll leave it up to you. Every practice is different, but here's a few things that I will share. I've seen front office team members deliver the tour and then take the patient either back to the welcome area or actually take the patient to one of the operatories. Now, there's a lot of coordinating with the hygienist or dental assistant or doctor to make sure that they're ready for their patient. And maybe you say, if I'm, team member Lauren and I'm up front, I'll say, Lauren, ready for patient tour op 3. So what that's doing is I'm notifying op 3 that I'm about to deliver a patient tour, but my goal is that I will be dropping the patient off in op 3, ready to transition that patient to the clinician, okay? So I've seen that work really well in a dental office. Depending on the size of your practice, you might say, Lauren, maybe that doesn't work for us, but we could have our patients be taken back up front. That's totally fine. Just make sure that you're paying attention to how many times your patient's getting up, sitting down, getting up, sitting down. What you don't want is a patient to walk in, you greet them with kindness, they go sit back down, they do all of their new patient packet, and then they come up and they sit down, then they get back up, then they go on the tour. Are you guys exhausted? I am. You don't want your patient to feel exhausted. So just make sure that you coordinate that very carefully. Sometimes what I like to do, if it's best for you to take a patient on a tour and bring them back to the front for the clinician to bring to the back, make sure you orchestrate it so that when the patient gets up out of their chair and brings you either that iPad with their new patient packet filled out or their clipboard with new patient information on, you don't let them sit back down. You might say, oh, Mrs. Jones, real quick, before you go ahead and take another seat, I'd love to give you a quick tour of our office before your hygienist brings you to the back. Would that be okay? And the patient will let you know if it's not okay, all right? But most patients are like, oh, sure, I've never actually gone on a tour. Sure, sounds good. And so that way they're not sitting back down. So keep that in mind, okay? So if you are the front office team member giving the patient a tour, you want to welcome them obviously to the office, thank them again. Thank you again for choosing us to be your new dental home. We're so excited that we get to have you. And make sure that you point out the really important information. Now, sometimes we get in our head about, well, Lauren, I don't want to point out the lab because our lab is really crazy busy or really chaotic. I might say, to my right, we do have an in-house lab where we do night guards and customized bleach trays, just something unique and special and a quick way to say, hey, by the way, we do night guards and bleach trays. So again, you don't have to actually open the door. You can just gesture to the door, okay? So I would point out the lab, sterilization. Hopefully your sterilization area is clean and organized. If not, I would really practice on getting it there, but hopefully it's clean and organized. And I would point that out. Sometimes patients want to know if the instruments that we use on them, if they're clean and if they're sterile. And guys, sometimes patients will ask the clinicians, are these instruments clean? Have these been used before or are these brand new? They don't know. Here's what I can promise you. Not every patient asks, but a lot of patients are thinking it and they're wondering, have these been used before or am I the first patient? So we have to tell them. We don't want them to ever wonder. We want to share with them that everything in our office is clean and sterilized. So whenever you point to the sterilization area, you may say, to my left, we have our sterilization area. Just so you know, everything in our office is clean and sterilized so that you're always going to have an exceptional experience with us. But most importantly, is your health and safety. So we make that a priority in our office. How do you think your patient's going to feel hearing that? Whew. Okay, good. Now I don't have to wonder about that anymore. They've already told me. And so you want to make sure that, again, you make sure that you answer the questions that your patients may be thinking and they're afraid to ask. The other thing that you might point out is some of the different x-ray equipment in your office. So sometimes we're wanting to point out the x-ray machines and the CBCT scan or the panoramic x-ray machine. Guys, I know we're all in dental and those are not intimidating to us, but sometimes they're really intimidating to our patients. And so I like pointing those things out. But I like to point them out in almost like a childlike manner. Here's what I mean. So we've all seen the pan machine and it's massive and sometimes intimidating. I'll point it out and I'll say, Mrs. Jones, this is what we call our pano machine. It takes a full panoramic x-ray machine. I'll tell you, kids especially love this machine because it goes all the way around their head, but it captures their big, beautiful smile. So I know it looks a little large, but it's a really easy way to capture all of your beautiful teeth. Guys, make it you. Make sure that you say something that you're like, gosh, if I were a parent seeing this for the first time, how would I want to be educated on this? How would my child feel looking at this? That's the type of verbiage that you would use. You want to make sure that if you're showing off your awesome technology in your office, you make it less scary, less intimidating. So that's why I like to bring kids into the conversation when it comes to the pano machine, because it takes that fear and anxiety off of the conversation of, okay, what is that thing? And what is that going to do to me or to my mouth, okay? So the other couple things that you might print out or share with your patient is if you've got a CEREC in your office that patients can actually see. Sometimes it's really cool to share that with patients. I'm always fascinated that patients love seeing the milling of their permanent crown. So if you have that, if it's in a great place where patients can see, point it out. It might prompt some conversations of some sort of cosmetic dentistry or something that is a goal of theirs. So those are the few things that I would point out. I've also been in offices where they're really involved in their community or giving back, or even going overseas and doing complimentary dentistry for patients in a community. And they'll put photos throughout the office, which, guys, if you don't have photos out in your office, I'm going to encourage you to do that. Brag on it. Have a community wall. Have photos on there and point that out. You might even say, Dr. Smith is really involved in our community. In fact, we all are as a team. He's done multiple mission trips, but we also give back to our community. So this is our community wall because it's really important for our office to give back and serve the people of our area. Guys, what do you think that new patient's going to think about your office? This is different. This is not a normal dental experience. It is above and beyond. They are going to be blown away. For some of you, your doctor does go above and beyond. Your doctor does do things in the community. And I'll share with you, a lot of times your doctors give back or donate to the community and we don't even know about it. So whenever we do know about a community involvement or them doing a mission trip, we want to capture that and we want to share it, in the office, but an opportunity to brag on our patients. The last thing that I'll bring up that is sometimes really great in a dental office is a smile gallery. So if you have a space in your office, and this is whether you are a cosmetic practice, an office that does aligners or ortho, anything that is, above and beyond, anything where you're transforming smiles, which guys, we're all in the business of transforming smiles, brag on your work. Have a smile gallery where you can showcase different patients over the years that you've served and their beautiful smiles that you've transformed. Now, docs, if you're watching this, I know sometimes you like to show the before and after. Here's what I'm going to tell you. Nobody wants to see the before. Your patients just want to see the smile that they could have. Now, if you have a one-on-one conversation with a patient in your chair, you can show them a before, especially if the before is very similar to their current smile and they're trying to have a certain look. They're trying to envision the after. But as far as a smile gallery goes, you just want to showcase the beautiful smiles that you have transformed when it comes to the after look, okay? So that was on the front office side. So you might say, Mrs. Jones, I'm going to give you a quick tour of our office. If you want to follow me, to the right, we have what we call our community wall. Dr. Smith is really engaged in our community, and she's even done several mission trips around the world. So we have some different photos from her trips giving back, but also some community involvement that we do. Maybe next you're going to the hygiene wing. Notice I said wing. It sounds really fancy. If you've got several hygiene operatories, feel free to use that verbiage. Next, we're going to go to our hygiene wing. This is where you're going to meet Kim, your hygienist. You are absolutely going to love her. I'll bring you here to her towards the end of our tour, but we're going to keep going. To my left, we have all of our doctor operatories. Notice I didn't say restorative. We speak dental, the patient doesn't. To my left, we have all of our doctor operatories. So if you ever have any cosmetic or oral health goals, or if you ever need to come back and see one of our doctors, you'll probably be in one of these suites. And then keep going. Maybe the next room is your sterilization area. We also have our sterilization room so that everything in our office is clean and sterilized, so you're always going to have a safe and healthy experience with us. Maybe next is the lab. We do have an in-house lab where we're able to do customized bleach trays. We're also able to do night guards. I don't know if that's a goal of yours, but we can absolutely do that for you. And we are able to do that in-house, which is really exceptional. And then finally, we have our smile gallery. So these are just some of the beautiful smiles that Dr. Smith has done over the years. Patients love coming to see either their smile once they've completed a large amount of treatment, or just seeing what their smile goals could look like at the end, and then keep walking with them. If you need another filler question, one of the best questions you could ever ask a patient is about their referral. So you might say, Mrs. Jones, how did you hear about our office? What brought you here? Let Mrs. Jones answer. She might say, I Googled you, one of the moms at the local ball field, she shared her experience with you, which if she says something like that, another patient referred, ask another prying question. Ask who, because you want to be able to thank that patient for referring you a patient. But you should also, hopefully you're doing some sort of referral contest or referral acknowledgement, you want to brag on what you're doing for your patients. So if Mrs. Jones says, actually, one of the moms at the ball field referred me to you. Her son and my son play ball together, and I was complaining actually about my last dental office, and she was like, just going on and on about how you guys are so unique, and was like, no, you have to call this dental office. I'm telling you, they're different. It's okay to say, may I ask who your friend is? I'd love to send her a personal thank you card. So when the patient says, oh yeah, it gives the first and last name, make sure you make a mental note to write that patient a thank you card. And if you're doing a referral contest, that's the perfect time to educate the patient about the referral contest, okay? So all of that you can use whether you're a clinician or a front office team member. The only difference is the transition or the handoff. So if I'm a front office team member and I need to take the patient to the operatory with the clinician, then I will take them back to the operatory and just say, Mrs. Jones, I'm going to go ahead and introduce you to your hygienist today. Kim is going to take great care of you today. Kim, this is Mrs. Jones. I've already taken her on a great tour of the office, so she's ready to see you. It's a quick and simple handoff. Same thing if you're passing the patient off to either a doctor or assistant. If you're taking the patient to the front office, back to the welcome area, you would tweak that verbiage just a little bit. You might say, so Mrs. Jones, I'm gonna go ahead and let you take a seat up front in our welcome area. Kim, your hygienist, will be up shortly to take great care of you. Do you need anything before she comes back, whether it's a restroom break or maybe you need some water? Let the patient answer. By the way, your clinical team members will thank you that you offered the patient the restroom before they take them back. Sometimes patients like to wait till the last minute, so don't be afraid to say, do you need a restroom break or would you like some water, okay? Clinical team members, there's just a small tweak in verbiage. The only difference is whenever you go out to welcome your patients in the welcome area, the obvious, introduce yourself. Let them know who you are. So whenever you go out front, you might say, Mrs. Jones, hi, I'm Lauren. I'm going to be your hygienist today. Or hi, I'm Kim. I'm going to be your dental assistant today. I'm going to be working with Dr. Jones. Whatever that is, just make sure that you pause for half a second and you introduce yourself. Now, for my clients who are in the South, we get away with this a little bit more, but every office is different. Oftentimes my Southern doctors, they love the power of a handshake. Guys, do whatever makes you feel comfortable. If that's super important maybe to your culture or your heritage, don't be afraid to walk out and introduce yourself and extend your hand to shake somebody else's hand. It is okay. I know for some of you, we're in post-COVID and we're still a little odd about, am I allowed to shake somebody's hand? Am I not? Please don't overthink it, all right? If it's important to you and you were raised where you shake somebody's hand, then go out there and shake their hand. It's okay. And if they pull their hand back, don't make it weird. Just be like, oh, that's okay. So again, my name's Lauren. I'm going to be your hygienist today, and I'm going to be taking great care of you. If you want to come on back, we're going to take a quick tour before we head to the operatory. You just make it conversational, okay? So that's really the clinical patient tour. Here's what I'm gonna tell you guys. I know that was a lot of information, and I know you're probably in your head on, oh gosh, Lauren, I can't say all of those things. I'm probably gonna screw it up. I'm gonna practice it, and all 30 times it's gonna be totally different. It probably will be. Guys, give yourself some grace. We are human. It takes us a long time sometimes to implement something new. Here's what I'm going to encourage you to do. After your next morning huddle, grab one team member and go through the motions and say, all right, team member, can I please take you on a patient tour? Don't laugh. Can I please take you on a patient tour? And I just need you to be the best patient you can be. I'm not going to stop. I'm going to do the full patient tour. Even if I screw up, I'm just going to pick up where I am and keep going. Guys, you gotta practice this. Don't let a patient be your first try on a patient tour, okay? Grab your team members. That's how we learn. That's how we grow. That's how we get better at something. Thinking back to your childhood, the first time you wrote your name, was it perfect? I highly doubt it. And that's okay. And over time, you got better and better and better. And you made your letters the way the teacher told you. And over years, you started to add cursive and you started to make it unique in the way you like to do your letters. See, our teachers are there to give us a guide. Guys, all of the verbiage that I talked about is just a guide. Use it, practice it, work with your fellow team members on it, but go through the motions and role play it because it'll allow you to become more comfortable and confident. Then, once you master some of this verbiage we've talked about, then you can make it unique. Then you can point out some specific things in your office that really just stand out. And you're like, gosh, if I were a patient, I'd really want to know this. So whatever that thing is for your office, just practice it. You will get better. I promise you. The first time you do a patient tour with a team member or even a patient, it might be a little rough. That's okay. Here's what I'm going to promise you. The next one will be a little bit better. And the next one will be a little bit better. And you'll keep learning, you'll keep growing, but you can't grow if you're not willing to practice. So if you need help, if you need guidance, we do have guidelines and scripts for these things, guys. And if you've ever worked with us, I'm not a huge fan of scripts, but we have them. Reach out, ask, say, hey, Lauren, can I have a script for that? Can I look at the verbiage that you're giving out? So guys, if you need that, please reach out to us. We love what we do. We're here to help you. We're here to serve you. And otherwise, guys, we look forward to seeing you soon.